Hello everyone, it's Veronica again. I'm still continuing to talk about the mental disorders. Today we are going to talk about eating disorders. Eating is normal. Everybody knows that eating is normal, but it can be associated with abnormalities. There are some eating habits that are not normal. Now there are some misconceptions that eating disorder is a lifestyle. No, it is not a lifestyle. You want to lose weight, you want to gain weight, you may end up yourself by being sick or predisposing yourself to unhealthy behavior. What are eating disorders? It is a behavioral condition characterized by persistent and disturbance in eating behavior and associated with distressing thoughts and emotions. And these eating disorders can be very serious and they can be fatal. Okay, eating disorders affects everybody. It can affect anybody, and it affects up to 5% of the population, and mostly it affects the adolescents and the young adult between 12 to 15 years or up to 25 years there. And most of the people who are affected by these disorders are women, and they are often associated with the preoccupation with food. Okay, these patients are preoccupied with food, they are preoccupied with weight or shape, or they have anxiety about eating all consequences of eating certain foods. Like, for example, these people, they want to remain fit. Let me put it in quotes. It's fit. It's not, they are not fit, they are sick. Because you have to, not to eat normally, the way you are supposed to eat. There are behaviors associated with eating disorders. Which are these behaviors? One of them is restrictive eating or avoidance of certain food. You avoid some food. Today you will say that you don't want to eat this, or you restrict them. You eat them in low amount. Another behavior is binge eating. Binge eating, what do I mean by binge eating? Binge eating, it's you eat excessively, you eat faster, and then you start thinking of either you have an alternative way of removing that food, or you don't want to remove it. It's inside. You remain with it. That is what is binge eating. There are purging by vomiting, or you can use laxative misuse. There is also compulsive exercise. You are exercising yourself. This behavior tends to become like it's an addiction. You are used to that. You are used to have restrictive eating. You are supposed to binge. You are supposed to purge or to vomit. They become addictive. Often occur with other psychiatric disorders, like anxiety disorders, like depression or mania. There is obsessive compulsive disorders. Also, alcohol and drug abuse disorders. Those are some of disorders that present in patients with eating disorders. Some of them, not all of them, said something of importance to you people. And thank you so much for listening to me. If you haven't subscribed, subscribe to my YouTube channel and keep updating yourself with these mental illnesses and other illnesses. Thank you very much. Bye.